of do-it-yourself gut health that we do every Thursday here. And we realized that the quality appears to not be so good with the live streaming. A lot of problems with the videos, very fuzzy, and the sound being off. So what we've done is we've pre-recorded a video and released it yesterday about the ileocecal valve syndrome and the ileocecal valve maneuver that I'm going to talk about today. And then at the end, I'm going to take your questions as well. So just a bit more about what I do. I'm a naturopathic doctor and I have a practice here in Australia, but my mission and my passion really over the last 10 years has been to educate practitioners about the proper treatment of SIBO and other functional digestive disorders, as well as educate patients about their condition. So this is really my offering to help people in need, especially now that we have all been in lockdown for, well, varying degrees of lockdown over the past couple of months. And it's a perfect time to really improve your gut health whilst you're at home and perhaps not as stressed with the traffic, etc. So that really was the intention behind the do-it-yourself gut health. But just a bit more about other things that are available to you when you are part of the SIBO Doctor either Facebook groups. We have SIBO Lifestyle and we have SIBO for Patients and SIBO Doctor Practitioner Forum for practitioners. And the website, the SIBO Doctor, has training courses and free resources such as the biphasic diet that I created many years ago, as well as other handouts and tools to help you help your patients and get them better. I'm also the host of the SIBO Doctor podcast. If you haven't listened into that, it's a podcast I've been doing monthly over the last 2 years, and there's a lot of great topics that may be of interest to you, such as food sensitivities and lots of different topics, mold, lots of great, amazing guests I've had the privilege to interview over the past few years. Okay, so let's get to it. Let's talk about the ileocecal valve syndrome. Let me just get this up here. So the ileocecal valve syndrome. Now the reason I talk about it is because it is part of the underlying causes of SIBO. Now, those of you who've been following me know this graph. I have it in several of my training courses, and it really kind of is a visual aid to help you understand the underlying causes of SIBO, or small intestine bacterial overgrowth. So we have here the different categories. The main one is the motility problem, and I've talked about issues around the migrating motor complex and etc. Now, the red pie slice is impaired flow through the intestine, and this is where the ileocecal valve comes in that it can be dysfunctional and cause SIBO or be a contributing factor to symptom development. So let me show you what I mean by that. Let's see if I can figure this out. Right, so here's the ileocecal valve. So when we look at it, it is the connection between the small and the large intestine. So here we have the ileum, or the last bit of the small intestine. And so just for a visual aid, we have this bigger graph here, but really zooming in, you have the small intestine that connects to the large intestine. This is not a great picture of the ileocecal valve, and for some reason I couldn't find a better one. But I like this one because it also gives you the sort of relation to the appendix. The appendix is actually a really important part of your anatomy in that it is an area where you store some of your original microbiome. And it's there to reseed your digestive tract if you've had terrible food poisoning or really severe gastroenteritis. Those, terrible diarrhea, it helps to reseed the large intestine with a proper microbiome. But really, the point is that this is the last connection between the small and the large intestine, and it's meant to have a little bit of pressure around it and open when the small intestine empties into the large intestine, and then close so that there isn't any backflow from the large intestine into the small intestine. So that's really the reason we're talking about it, is that it can be dysfunctional, and I'm going to show in the video that I posted yesterday, you have the technique of how to help close it or open it. Now, I will say that the ileocecal valve maneuver is part of the gastrointestinal practicum, or the functional gastrointestinal practicum that we did with Dr. Steven Sandberg-Lewis a couple of years ago, where he came out to Australia and he taught many of the practitioners how to do a proper physical exam, or how to use also different or functional testing to determine location of problems. And it was a really amazing weekend, and that course is available on the SIBO Doctor, so you can have a look at that. I was trying to show you an image of that, but it's just appearing not to get loaded. So, but you can, if you go to the SIBO Doctor and look at other courses for practitioners, you can find the functional gastrointestinal practicum that we did. And this particular maneuver is in much greater detail and much more moving parts for the practitioner. But oftentimes, as practitioners, we teach our patients how to do this at home, so that that you can sort of tonify the valve. And the problem being is that if it's chronically stuck open, it can be chronically stuck open or chronically stuck closed. And that's really the issue here, that you can have systemic symptoms and you can have local symptoms if you have a problem with your ileocecal valve. So what are the symptoms of ileocecal valve syndrome? Can be abdominal pain, and I often see this in the right lower quadrant around the area of the appendix. Can be really sore to touch, can have a bit of swelling. You can have abdominal pain really anywhere. You can have referred pain to the shoulder even. You can have even things like carpal tunnel syndrome be related to the ileocecal valve. You can have diarrhea, you can have constipation, nausea, and also sort of inflammatory symptoms systemically with arthritis, etc. So it's a really vague and broad category of symptoms, but locally we see a lot of pain, especially when we palpate or kind of dig it or feel a little deeper into the right lower quadrant. Okay, so that's really what we're talking about. The video has been posted yesterday, and I think we've just reposted it in the comments. So if you do have a problem with chronic lower quadrant pain or abdominal pain, or when you dig around your right hip bone, you have a lot of pain, or you have constipation, continued diarrhea, you might find this maneuver really helpful because it's something that you can do at home. It takes 3 minutes and it's super easy to do, and it kind of feels good. The issue here is that, you know, in your abdomen, all of your organs aren't just sort of flopping around, but they have a membrane covering called the fascia. And when the fascia gets sort of stuck on the side of the abdominal cavity, this is when the ileocecal valve can become problematic. Or if you have scar tissue there because you had your appendix removed, or you had colonic surgery because of inflammatory bowel disease, all of these are huge risk factors for ileocecal valve syndrome. If you have SIBO and any of the symptoms I've mentioned, you can also have ileocecal valve syndrome or be a contributing factor, because if you think about the location of this valve, and let's say it's chronically stuck open, you can actually have a bit of reflux from the large intestine into the small intestine, causing SIBO. So this is why we really wanted to kind of highlight the ileocecal valve a bit more, because it's something easy that you can do at home, and it's really helpful. It's not going to be the cure for everyone, but it's something to consider if you have ongoing symptoms, even though you've been in treatment for SIBO or irritable bowel syndrome. Okay, that was sort of it, because we released the video yesterday. If you're just joining us, the reason why I'm not showing you the video is because we pre-recorded it for you, because the quality of these videos has been less than optimal. For some reason, it might be because we are fairly rural here in northern New South Wales. So we've pre-recorded the ileocecal valve syndrome. The Facebook Live is just to kind of introduce it and to answer any questions you may have. Already some questions came up yesterday about the actual maneuver. And one of them was about the tractioning, and it'll become clear. If you don't know what I'm talking about, just watch the video, and then, you know, this question will become clear. But the direction of the traction. So the basic maneuver is that you're lying on your back, you find your right hip bone, you push down from your hip bone down and then towards your navel. So really pulling the underlying fascia, so not the topical skin, but the underlying fascia, which is the connective tissue that sort of covers your organs, goes, and you want to pull that towards your navel, right? And you want to hold it there for 3 minutes whilst you're rotating your right leg in and out very slowly. And that movement and the traction helps to kind of get the ileocecal valve fascia unstuck from the side of the abdominal cavity in the pelvic bowl. So this is a sort of an older chiropractic physical therapy type of movement that can be really helpful. Somebody was already saying she saw the video, she's going to try it tonight. Now, great, I'm very happy to hear that. And just remember that a one-time treatment isn't going to do it. You're probably going to have to do it every night for some time to really get the ileocecal valve unstuck. And I would try it probably for a good 2 weeks for you to notice any improvement in what? In constipation or diarrhea, abdominal pain, nausea, any of the symptoms I've mentioned before. So that's what you're looking out for, and just a general sensation that this is a feel-good treatment on yourself, right? So that's really what we're looking for. Okay, good question, Nellie. Is there any sort of imaging that could diagnose ICV syndrome? Great question. Not to my knowledge. However, you just jogged my memory on something I do tell my patients a lot. When they get a colonoscopy, right? So a lot of patients that have IBS, usually, you know, there really aren't that many tests for them. So typically gastroenterologists just start with a colonoscopy, which is kind of, anyways, that's a whole nother topic. But let's say you had a colonoscopy or you're scheduled for a colonoscopy. This is perfect time to ask your gastroenterologist to just notice when they come upon the ileocecal valve, whether it is open or closed, right? So normally the ileocecal valve is closed, and then it just responds to when food squeezes through the terminal ileum, or the last bit of your small intestine, into the large intestine. That's when it's meant to open, right? But if it is open when the gastroenterologist advances with the scope, then that might be an indication of a chronically open ileocecal valve, which could mean that this is a contributing factor to your SIBO. So it's a good time to do this. Other than that, there aren't really any imaging techniques that can determine this. In the gastrointestinal practicum course, you, as a practitioner, if you're a practitioner listening to this, that's really, it's a course meant for practitioners, that it helps you to determine if it's open or closed. So, and then you have different maneuvers to either close it or open it, or just get it unstuck. This maneuver in the video that I released yesterday is a general instructional video for patients to do this every night for 3 minutes before going to bed. Set your timer, because it does take 3 minutes to do. Okay, so that really is my Facebook Live for today. I wanted to clarify the video that we released yesterday. Hopefully the quality is much better than the Facebook Lives that I've done in the past. And if there are any questions, I can also take questions at this point. If you want to type them into the comments. In the comments, there should also be several links that you can click on to get you to the video or to get you to the training course that I've talked about if you're a practitioner and listening. We will be doing these, continue to do these, even though lockdown restrictions are lifting, I think, in many places in the world. So, but we find this, pretty helpful. So I think next week, we had a really terrible time with the sprouting video with Anne Kreiner. So we're going to try to actually film, maybe not sprouting, but some other aspects. She's our nutritionist here at the Biome Clinic, and we're going to record something and then release it and then do the Facebook Live as I'm doing now with the Facebook Live following the release of the video. Okay, another question. Are antimicrobials such as berberine, neem, or allicin okay to take if pregnant? So the only one in that category is allicin, not neem and not berberine. They don't have really, we can't guarantee that, but allicin coming from garlic is really pretty safe. Okay, let's see if I can get rid of this picture here. There we go. And we'll go back to here. All right, excellent. Well, just wanted to clarify that. I know that there aren't many questions because many people haven't watched the video yet. This is a new process for us to release the video first and then do a Facebook Live. So hopefully you are getting a lot out of these Facebook Lives. Avery, thank you for buying the course. Wonderful. If you've bought the SIBO Success Plan or the SIBO Mastery, those are really the training courses I talk about. You can find them on the SIBOdoctor.com. And I wish you all a wonderful day, weekend. Let's get through this soon, the COVID-19 crisis. And I'll be back here next week. There's one last minute question. Do you think that breaking an extended 10-day fast by gorging on food and beginning to refeeding process poorly can cause SIBO? That's a bigger question. So it doesn't cause SIBO, but if you didn't clear it before, then you might have a resurgence of SIBO or a relapse. So it's all about clearing SIBO. You can't really do that with diet alone. Okay, excellent. How deep do we push? Good question. So I'm hoping you've seen the video, Laura, but this is the toughest bit about explaining how to do either a physical exam or how to do a treatment on your own. But you really want to push down to where the idea of the maneuver or the release is that you feel traction and that it's not just a gentle push or traction. It really you're pushing down fairly strong. You don't want to elicit pain, but you do want to have a sense of traction. This is the caveat, of course, with releasing videos where I can't show you in person. It's very difficult. So do the best you can. Push harder than you think you should, but don't cause pain. Hopefully that's clear. Good, Laura. Rewatch it because at the end you do see how much my model is pushing in. I'm hoping you can see that. And if you're a little overweight, you have to go a little deeper, right? You do need to get deeper in, and that's why you use your hip bone as a location point, and then you slide your fingers right down the hip bone and towards your navel, so that you bypass fat, muscle, all of that. Okay. Janet, wonderful. Thank you. Anybody who's watched the SIBO success plan, thank you so much for your feedback. If you can share it in the group or write me a little testimonial or any of that is so helpful, because we're trying to get the word out. The SIBO success plan is the training course for patients that educates you on everything you ever wanted to know about SIBO, IBS, food sensitivities, leaky gut, and how to help yourself. So it's a standalone course. You can do this either with a practitioner that's helping or on your own. It's always better with a practitioner, but it is an educational course. So the video, Stasia, should be in, well, all the videos that we've ever recorded here on the SIBO Doctor is if you go to the video library. So it's just look on the page and they should be all videos. You click on that and it should be entitled with the topic, right? But it should also be in the comment section. So have a look there. I only just posted it yesterday, I think. Yes, I did. So so have a look. It won't take you long to scroll backwards in time. All righty, folks. That, I think, is it for me. If you want to tune in again next week for another episode of Do It Yourself Gut Health, next week I'll be talking to Anne. Again, we will probably pre-release a video and then do a Facebook Live about it, just so that we keep the quality good, because the BeLive platform that we're using is has told me that our internet is too slow for these things, sadly. So, all right, excellent. Until next week then, people, stay well, and I'll see you next week.